Okay. So, hello, everybody. Welcome to this webinar. I'm Harry Campbell from Biofeedback Resources International. And we have also Dr. Jorge Palacios. And we're going to be talking about biofeedback and neurofeedback. I'm just checking the waiting room here to make sure I let everybody in as they come. So thank you for joining us. So we provide the biofeedback and neurofeedback training programs. And we want to talk to just start talking about biofeedback and neurofeedback in general and some of the applications that it's used for. As I said, we're going to just talk about some of the applications of biofeedback. One of the, I guess, main applications that biofeedback is very well known for is stress-related problems. So we think about things like anxiety, performance problems, people that have trouble falling asleep, people that have things like hypertension and so on. And then we also have other issues that would be related to medical problems like pain. Many things like pain with headaches, pain with neck, pain with back, chronic pain, fibromyalgia, and so on. And then we have neurofeedback, which we'll talk about a little bit more later. But Dr. Palacios, what comments would you have about some of the applications?
Well, first of all, hello, Harry, hello, everybody. Nice to be with you. Just for those who doesn't know me, I'm Dr. Jorge Palacios from Biofeedback Center at Mexico City. And yes, we are meeting today for talk to you about our next seminar that is going to be held in another location. Maybe our guests do not know, but we have been holding these seminars, some of them online, many of them in person in the beautiful city of Miami. But due to different options, this year we are offering our seminar. We are moving to St. Pete, better known as St. Petersburg, also in Florida, but now in the coast of the Gulf of Mexico, or Mexico, as you prefer to say. This is going to be from September 16 to, February 16 to 22nd. This is going to be on the next month. This seminar is going to be for biofeedback, first of all, as Harry was telling us, related to the main applications of biofeedback, and also to the applications, the basic applications of neurofeedback. Health, as I already said, from February 16th to the 22nd, it is going to be related to all the basic topics that are considered as the basic training that everybody has to have to ask for the BCIA certification, which is the international type of certification for practitioners in the field. So we are going to talk about the basics in biofeedback and feedback instrumentations related to biological signals, acquisitions, analysis, and also we are going to talk about the basics and all the principles related to the feedback or biofeedback procedure. Also, we are going to mention the main applications related to all the peripheral issues, all the peripheral conditions related to arousal, like for example, stress and also anxiety. And we are going to talk about muscular rehabilitation or muscular re-education, and all the applications related to, for example, fascial palsy or pelvic dysfunction, muscular dysfunction. Related to neurofeedback, we are going to talk about ADHD, which is one of the most popular applications of neurofeedback, but also about depression and the way it is managed with through neurofeedback, and complex applications of neurofeedback basics, like for example, PTSD and the applications related to this field, like for example, addictions, mainly alcoholism. In the last part of our event, we are going to talk about brain mapping. We are going to dedicate some time to talk about the more recent advances in brain mapping and brain mapping analysis. So that's part of our work, as I understand, Harry.
Yes, yes. So one thing that I wanted you mentioned about the BCIA certification, which obviously for many people is very important. There is the certification and the things that the certification might be helpful for many people to have, and then there's the learning. You know, there's the learning of how to do biofeedback, how to do neurofeedback. And honestly, there are some people that never get certified. It's something that is very much recommended to get certified, because it shows a level of preparation for a certain level of preparation for doing biofeedback or neurofeedback, where let's say someone maybe who is licensed just buys a piece of equipment and they read the manual and start doing biofeedback or neurofeedback. Well, that's not good. The person needs to understand what it is, what they're measuring, why they're measuring, how it's measured, how to apply the sensors, how to work with the client. All of these things are very important. And it's not the kind of thing that you may get just from reading a manual. So the certification has a series of requirements that, whether or not a person is getting certified, I think many of the requirements would be helping a person to prepare for providing biofeedback or neurofeedback. So I'm just going to show some of the requirements and what BCIA says about certification. So I'm just going to share my screen. Let's see. Okay. And hopefully now you will be seeing my screen. Are you seeing the hang on a second here. Okay, are you seeing the certification screen? Okay.
Yes. Yes,
All right. So this is the BCIA's website, bcia.org, and it has here the different types of certification. First, we're talking about the biofeedback, and it has what is required for that. And one of the things I wanted to show you here is this list of the things that are to be covered in the training. So you have the didactic biofeedback education, and it shows the number of hours and also the areas that are covered: orientations or history of biofeedback and so on, stress, coping and illness, psychophysiological recording, research, methodology, surface EMG, That's for measuring muscle activity. You have autonomic nervous system and applications, respiratory application, intervention strategies, and professional conduct. Within the training and after the training, they also want you to do practice. Well, if you're going to do practice, then you need to have learned how to do the practice. So in the training, you get prepared to and have some time to practice, especially in the in-person classes, with each of the modalities, and which we'll go over. And then afterwards, you would be able to then do these practice sessions for 50 practice sessions for the biofeedback, and 10 sessions would be for temperature, and then EMG and heart rate variability each. And then the remaining 20 sessions could be any combination of EMG, temperature, GSR, heart rate variability, and respiration. And so this shows some of the detail of what would be necessary for the training and also for the certification. Were you going to say something there, Dr. Palacios?
No, yes. Continue, please.
Yeah, so then we have each of the modalities that are covered in the biofeedback would include surface EMG, that's for measuring muscle activity. Then you have skin temperature, and that has to do with changes in the circulation of blood to the hands or feet in some cases. When there's more circulation of blood, then the temperature is higher. When there's less, it's lower. Then we have skin conductance, or sometimes people would refer to it as GSR, which is indication of changes in sweat activity on the hands, usually. We have respiration that measures breathing activity, and you have heart rate and heart rate variability. So those would all be considered what we call peripheral biofeedback, or when people are using the terms biofeedback and neurofeedback, they would mean by those things I just listed, they would be talking about biofeedback. And then for neurofeedback, we would be more looking at the EEG and brain activity. So did you want to expand someone on any of those things?
Yes, of course. Well, we have to think that one of the points that you said is very important. It is very common that many people buy equipment and think that they are going to be ready to work with patients and start doing research, if that's the intention, just by reading the manual. The reality is that when we are talking about biofeedback in general, that means peripheral biofeedback and EEG biofeedback, we are talking about a scientific field that has more or less 60 years, is 60 years old. Biofeedback started in the 1960s decade. There are two main works that are the milestones for biofeedback. One is the work of John Vivas-Mayan in Canada, that is the scientific who developed the EMG biofeedback specialty. He began working with EMG biofeedback, electromyographic biofeedback, for the rehabilitation of muscular palsy. He developed the specialty of EMG biofeedback applied for recovery of function after brain lesion muscular palsy. It is an important field in which the most important contributions of peripheral biofeedback have been made since those years. As you can imagine, the development of this specialty is just enormous. not only from the new devices that are specifically built for this type of application, but for the advances in the design of the software and the new deep learning and machine learning solutions that has been developed for this type of applications. After this big contribution, it's fair to say that John Vivas Mayen was one of the presidents of the beginning of the biofeedback, the American Biofeedback Association, more or less in the 1970s decade. But I think he was the 11th president, as far as I can remember. And the other big contribution that is also worldwide known is the contribution of Joe Camilla. Joe Camilla was an assistant, research assistant in one of the most important sleep research laboratories. One of the most advanced research laboratories in sleep in general, in human sleep. In that time, it was the laboratory of Dement. It has to say that this researcher, Dement, along with Kleinman, were the first one that described with very specific precisions the characteristics of the rapid eye movement stage of sleep. In those days, it was called the fifth stage of sleep. Now it is called the REM only, or the R stage in the human sleep. So he was working with this type of research, and he was preparing all the subjects for research and for doing all the EEG recordings. You have to be placed in the 1960s decade, where the only eight channels EEG recording systems, 8 channels, were just the most advanced research machines, not only for clinical work but also for research. Today we can talk about 512 channels EEG devices. The difference are just enormous. But in those days, this was just enough for working with EEG and sleep disorders research. And this scientific assistant was preparing the participants. He asked them during the preparation to close their eyes. He was reviewing the recordings, waiting for the stabilization of the signals, and he noticed that it doesn't matter that the participants work with the eyes closed, which is the basic condition for the alpha waves to appear. There were moments where this activity, the alpha waves, were blocked. So he started to think, what happened in those moments? Why this distinctive activity of the eyes closed condition was blocked, even when the participants were with the eyes closed. So he began to think that maybe some kind of cognitive activity was taking place in that precise moment where when the alpha activity is being blocked. He managed to design an experiment when he was able to inform to the participants in a new different experiment, not with the sleep research, if these participants were with alpha activity or with no alpha activity, just sitting there in a specific research room with the eyes closed. For that, he used a specific tone, and also the variations of the volume of the tone were analog to the intensity of the activity of the alpha wave. In that moment, 1962, this man was designing the first EEG biofeedback procedure, which is used until today. But he was not only satisfied with this, he also designed a method to use a specific score that at the ending of the recording session was going to be used to inform the participants about the development. So when we are talking about biofeedback and neurofeedback, we are talking about a scientific field that has a long tradition of work that started in those days, that is based on the solid research of people like Georgi Adam, that scientist in he was Hungarian, and he developed all the basic research for the study of interoception. Interoception now is a strong field of knowledge which is supporting all the biofeedback work. And we are talking also, well, he was a student of Ivan Petrovich Pavlov, the great man of the classical conditioning work, which was one of the fundamentals, as well as the operant and instrumental conditioning that was all the basics and fundamentals of biofeedback and modern biofeedback and modern neurofeedback. Today we have a lot of devices, the so-called commercial devices. They are, some are very traditional, others are very sophisticated. I understand that Harry has some sophisticated devices, like, for example, folk technology, which have different kind of features that can be used in for biofeedback and for neurofeedback. And there are a well-defined set of applications for these two type of specialties. For doing that, for being a specialist in this field, one has to be trained. And our seminars, we are held this type of training just to give the basic and solid training to our students, so they can have the certification exam at the BCIA, and also be practitioners in the field. These are the fundamentals that are going to be taught with all the new technology advances, with all the methodology, the basic methodology that has been developed through all this year, and is based in solid research. Well, that's part of our seminars, as I understand, Harry.
Yes, thank you. And so with that, I wanted to, and that was a great history. I enjoyed that too. So I wanted to just kind of show a little bit of one of the software programs that we use, that I use a lot in my work and in the training, the thought technology, as you had mentioned. And I'll just share my screen with that. Let's see if we can do this. Okay. So this is a software program that I use quite a bit. And with this, I use it mostly for EMG, temperature, skin conductance, respiration, heart rate, and heart rate variability. And I also do some simple EEG with it as well. We may use for other applications that require more channels, other equipment for EEG, which I think Dr. Palacios will talk a little bit more about. But I'm just going to show you here without doing a whole demonstration where I hook sensors up and everything, just to show you what a screen might look like when we're doing training. And one of the things that's really interesting about biofeedback and using it for applications like we talked about is it helps people to be able to see what they usually can't see. There are things that are going on in the body all the time, and reactions to thoughts and so on that people are just not aware of, or maybe habits that they have that they're not aware of, and the instruments allow them to see it and allow them to learn to change it. And so this is an example of looking at a screen that would be showing muscle activity. So here you have the activity being graphed, and you can see immediately when a muscle contracts how quickly you get a reaction in the reading. And this would be a goal or a threshold that we use that we could adjust. And so the goal might be to keep the muscle tension below that level. And you can see if it goes above, then the color of the line changes, and also the volume of the music changes. So that's an example of using it with muscle tension. You can get readings to see how many microvolts, which is how we measure muscle tension it is, and so on. I'll go to another thing to show you here that I think would be useful. This is showing heart rate variability. And so with this screen, we're going to be looking at heart rate and breathing. We have two sensors that would be measuring. So there's a sensor that goes on the finger to measure heart rate, and then there's a respiration belt that goes around the body to measure the breathing activity. And this is just one example of how this might look. This green line is showing breathing. So when the person inhales, the line goes up. When they exhale, it goes down. And then the red line would be showing heart rate activity. Here you can see the person not really breathing very rhythmically at all. And hopefully it improves after that. I don't remember which recording this was, what the person was doing here. Now you can see the heart rate is kind of jumping around. That might be a little bit of an artifact, which that's another thing that we talk about in the class, is when you put the sensors on, how you put them on can be very important. And also things like limiting movement. If a person is moving their hands around while you're trying to record, you may get these types of artifacts. See faster breathing where the line is going up and down much faster. And you see the number under the respiration rate will go up when the person is breathing like that. Now this is holding the breath. So you see the green line not going up and down. And now these are a little bit slower breaths. So you can see how the green line is really showing how a person breathes. Sometimes people their breathing is all over the place. They breathe shallow, they take a deep breath and they hold their breath. Sometimes it can go like that. And then you use this to train the person to breathe in a way that is going to be better for their health. If we're trying to increase heart rate variability, sometimes we may be having them breathe differently so that they can be more relaxed. And that may also do things like increase their hand temperature. So let me see if I could get a better, see now I'm hoping that we get slower, deeper breaths now. That's a little bit better. Not great, but it's a little bit better. And we're still getting some artifact there in the heart rate. So I'm going to stop sharing there for now. And ask Dr. Palacios if you just talk a little bit about the EEG and what we do with that.
Yes, well, we are going to talk, as I already said, about the fundamentals of the technique, how to do EEG recordings, how are the fundamentals about instrumentation, how do we place the sensors, how do we prepare the skin in order to obtain the best signal recordings. We are going to talk about the different techniques, international techniques for placing electrodes, the worldwide known since 1956, 58 technique, which is called 1020 International System. This system was the first one to used for placing electrodes in the scalp in order to systematically obtain this, the EEG signals, and that can be compared with other persons, one recording from one person with another one. There are new systems that were developed in the 1980s, 1990s. They are called the 1010s international system and the 10.5 international systems. These systems allow to place more number of electrodes with also standardized techniques. We are going to, in neurofeedback, the 1020, which is based of 19 electrodes placed in the with the 10 and 20% of the distances between certain fiducial points of the head are used to obtain EEG signals systematically from one person to another. We are going to talk about these techniques before we use the systems, and then we are going to use the systems to obtain different kind of recordings. The basic recordings that in the neurofeedback field are called baselines, with the eyes closed, with the eyes opened. There are substantial differences in the EEG recordings when one person is with the eyes closed and with the eyes opened. And these type of recordings in the neurosciences field are called resting state conditions. And after that, we are going to use the devices to demonstrate and to show to our students how the system are used to train the brainwaves, how a person can learn to modify the organization of the brainwaves. Brainwaves have the possibility, due to brain plasticity, due to neuroplasticity. In fact, it is called electrical neural plasticity, there are three different types of neural plasticity: anatomical one, chemical one, and electrical. Well, neurofeedback is based on this natural property, which is the basics of learning. And we are going to use this property that is present in all the living brains. It doesn't matter. The brains are experimenting profound lesions. This property is present. So we can use this property by means of the devices to reorganize the activity. For example, the most basic application of today is the measure of one relation, which is called the theta-beta ratio. This means that is the result of the comparison between the activity in terms of amplitude, in terms of microvolts, which is the unit of measure of brain waves, of one brainwave, which is called theta, which is one of the slow waves, and it is between the 4 and the 8 hertz, which is the measure. Hertz is the measure of the frequencies in general, in this case, in electrical activity of the brain, against or in comparison with the activity of the beta waves, more precisely the beta 1 waves, which are the fast activity. This is between the 15 and the 18 hertz. It happens that when the theta-beta ratio is high, that means that there's a lot of activity of theta waves and a low activity of beta waves. There are attention deficits. Up to now, and since 2013, FDA agreed to accept theta beta ratio as a measure, as a clinical measure of attention deficit disorders. So with the machine, we are going to measure this type of activity. We are going to obtain the value of this type of ratio. And if it is proper, we can revert the value of this ratio in order to train the brain to reduce the value of the ratio theta beta and to increase. That means to invert the value of the ratio, increasing the activity, the voltage of the activity of the beta waves. That's a way to promote the recovery of the deficits in general in attention. That's one of the applications, of the many applications. These principles are used for depression also with another measure, which is called the alpha asymmetry in the frontal area of the brain. And also we are going to do demonstrations of the neurofeedback, or the feedback of the alpha theta waves and the way they are balancing the activity. This type of training, the alpha theta training, was promoted, identified and promoted since the 1990s by Peniston and Kulkowski, who developed these applications for the treatment of PTSD and also for alcoholism. This type of training is very powerful for type of application. And also we are going to do brain mapping. If Harry, if you allow me to share one of my screens, I can talk very quickly about brain mapping. Brain mapping is a technique not to doing the recordings with 2, 4, or even 8 channels or EEG, but also with more than 19 channels, 32 channels, for example. And we're going to do one type of recording of 32 channels, and also to promote the analysis of the brain waves in a different with a different type of procedures. That will be an extra to the traditional training of in this seminar. An extra that we have been offering since some time.
Sure. So, and maybe we had mentioned that maybe we'll do another session in a couple of weeks, so maybe we can do that part at that time. Yeah. One other thing I was going to just show quickly is the information on the neurofeedback requirements of BCIA, and they consider this the entry level person who is relatively new to doing neurofeedback, the requirements for certification, the neuroanatomy and neurophysiology, didactic education. So the didactic education is what we would be doing, but we also do lab practice, working with the equipment and demonstrations. Mentoring is something that's done afterwards. And then I also wanted to show you the what the didactic education is made up of. So you have orientation to neurofeedback, basic neurophysiology and neuroanatomy, instrumentation and electronics, research, evidence-based for neurofeedback, psychopharmacological considerations, basically how medications and substances can affect the EEG, patient-client assessment, developing treatment protocols, treatment implementation, current trends in neurofeedback, and ethical and professional conduct. And then after, for people who are going for the BCIA certification afterwards, one of the requirements is doing 100 practice sessions, which sometimes people feel like that's a lot, but it's really not. If you think about it, this is something that it's very doable, but it takes practice. It takes learning and it takes practice. So the learning part is, we work with people to help them learn what they need so that they can do the practice session. So you don't come out of the training and start seeing your paying clients right away. You practice so that you can get better at even just putting the electrodes on. Takes practice and getting comfortable with it. And so that's what we prepare you for. Any other comments you wanted to make? And then we can, maybe we have time for just a couple of questions and then we'll wrap up. Did you have any other comments you wanted to make, Dr. Palacio?
No, for the moment. I would like to hear the questions of our participants if they have.
If anyone has a question, you can unmute and ask your question, or if you are shy and you want to type it into the chat, you can do that too. And I'll take a look at the chat. So I don't see anything there. So as Dr. Palacio said, we have the next biofeedback training is going to be in St. Petersburg, Florida, from February 16th through the 19th. And the neurofeedback will be same location, the 21st through the 23rd. If you want more information on that, you can, oh, I see a question here. You can contact me through our website. is biofeedbackinternational.com. My email address is harry@biofeedbackinternational.com. And if you prefer to call, the office number is, if you're calling from within the US, you can use 877-669-6463. If you're calling from outside, then the number to use would be 914-762-4646. So I do see a question here. It says, let's see, while I was a pediatrician in Japan and have a Japanese medical license, I'm now a research scientist in the USA and do not have US medical license. Can I apply to BCIA certification with Japanese medical license? And how can I practice neurofeedback, biofeedback technique and clinical under mentoring here? Could you provide practical skills training with mentoring? So thank you for the question. In terms of being able to practice independently and get a certification from BCIA to practice independently without having a license in the US to practice in the US, you wouldn't be able to do that. But there is a technician certification that you would be able to qualify for, and then you could do neurofeedback under supervision of someone else who is licensed. And if you need further clarification on that, I'd be happy to talk to you more about it. And then we can also help with the practical skills training and mentoring. So that's something else I can also talk to you about. So I hope that answers that question. And if anyone else had any other questions, let's see. Yeah, if anyone else has any other question, you can let me know now, or you can contact me afterwards and be happy to answer any questions. So hopefully that gave you at least some basic introduction to biofeedback and neurofeedback and some of the applications, and a little bit about how the training that we offer works. And hope to see some of you at the training, and do contact us if you are interested, and or if you have any other questions. Did you have any other comments you wanted to make, Dr. Palacios?
No, for the moment, just that I hope our assistants, participants to this webinar are interested to join us in the seminar. It is a big seminar. It's a lot of information. It's difficult to talk about all the things that we're going to say in this event. Maybe it will be also of interest that they will have the opportunity to be in St. Petersburg or St. Pete, which is a beautiful city, to know the city, to be in the nice weather with a good climate, and also learn a lot of biofeedback to get introduced to this field. But you said it's very important. For if you have to practice in the United States, you have to be certified. There's no other choice. If you are in another country, well, you can get certified also in the BCIA if you want to, and also you can create your association in your country and get certified with your association through the BCIA, because the association of different countries are affiliated to the BCIA, so they can certify also the specialists in their native countries. So it is a big organization that is trying to get organize the field of the professional practice of biofeedback. And I think that is a most, really a must these days. After all these difficult years, there's a lot of people that is in need of attention, of non-pharmacological attention. And biofeedback and neurofeedback are the non-invasive tools for excellence, by excellence. So there's many people with needs and that want to be treated with no pharmacological intervention. So for that, we need a specialist certified. So I invite our participants to get certified, beginning with our seminars.
Thank you. All right, well, thank you everybody for attending, and we hope to hear from you and speak with you and hopefully work with you. And Dr. Palacios, thank you for joining me, and we will talk soon.
Thank you for the invitation.